Welcome to the My Care channel. Today, our topic is about the different support systems within the aged care sector and how they have reacted to the recently concluded Royal Commission into Aged Care Quality and Safety and the 2021 federal budget. I'm joined with Sarah Barter of Sarah Barter Consulting, who has extensive experience in public health and the aged care sector. She is predominantly concerned with challenges and opportunities that are depicted within primary care, chronic care, integrated care, patient-reported measures, Aboriginal health, and child and maternal health in New South Wales. So my first question today, just to maybe give us a bit of context for the audience of the My Care channel. So in general, what sort of services are offered to people in the aged care sector in Australia?
Sure. So any person who is over the age of 65, who is non-Indigenous, and for a non-Indigenous, I believe it's slightly younger, who believe they would benefit from government subsidised aged care, should go to My Aged Care, which is the government portal in which they can organise to get an assessment from an aged care assessment team or a regional assessment team to determine what sort of services and supports they might need so that they can live the best life that they can. And the options that they might have would be to have some short-term support in their home. So that could be through the Commonwealth Home Support Program. That might be having some meals delivered or some transport or some home modifications or allied health services, just for a short period of time to allow them to settle at home. Or it could be a more longer-term home support package through a home care package, and they are at different levels, which give different levels of funding to get more long-term support to stay in the home. And then the third option is to stay in a residential facility, and that might be a short-term basis or a respite basis or a long-term basis. So basically full-time living in a residential aged care home, which is now your home. And generally that allocation of whether you want short-term support in the home, longer-term support in the home, short-term support in a residential aged care home, or permanent residency in a residential aged care home will depend on the complexity of needs and your own sort of personal situation.
Right. So there seems to be a lot of variations in the services that are offered to the aged care sector, which is, I think, a really good opportunity. There are a lot of options for people to sort of test out what they'd like and all that. So overall, would you say that the quality of the aged care sector in general is quite good towards both people that are, I guess, using these services as well as offering these services?
So the tricky thing about delivering quality care is that there are thousands of different providers. So whether you're getting short-term care or longer-term care in your own home or in an aged care home, that will be delivered by a provider. And those providers may be really big for-profit organisations. They may be really big not-for-profit organisations or charities. There are governments and local councils that deliver some services. There are smaller for-private organisations and sort of medium-sized providers. Some of them may offer home care, some residential, some both. And really the quality of the care does depend on the quality of that organisation in terms of their governance, their leadership, their culture, as well as the quality of the workforce. And that is, have they been able to attract and retain staff who can deliver care and services of an appropriate standard that is both safe and quality. So quality really does vary quite widely. And in order to be able to understand whether you're going to get quality care, you really need to have a little bit of a look to see it. Who is the provider? Who is delivering it? What is their history of delivering that care? And what it is that you specifically want and whether they can meet your needs. From the provider point of view, the providers really need to focus on looking at what is your leadership and culture. You know, how are you attracting and retaining your workforce, and what sort of systems and processes can you put in place to make sure that people are receiving a safe and quality service?
Right. Yeah. So that sounds like, so obviously like the variations in providers of aged care are inherently linked to the quality that's offered by all these providers. So obviously, regardless of who is providing aged care facilities to the elderly in Australia, they'll all be affected by the recently concluded Royal Commission that just concluded in Australia. I think it was earlier this month, I believe. So do you think the results from the recommendation of the concluded Royal Commission will affect these services?
No doubt. So people who have been receiving aged care and people who have been delivering aged care since the Royal Commission's started, and even before that, when Four Corners episode aired their episode on Who Cares, as well as even before that, people providing the services and people receiving the services, we're all aware that there were significant challenges in maintaining consistent quality of care and safety of care across all settings by all providers. And the Royal Commission certainly found that there were significant deficits, and going so far as titling their first interim report neglect. So it's clear that the sector itself has systemic problems that are resulting in a lack of consistent quality care. And consumers know that, community knows that, providers know that, government knows that, and now that's written in black and white in a Royal Commission report. There are hundreds of recommendations, I think it's more than 100, and the report stretches to thousands and thousands of pages. In those recommendations and in that report, there are good indications and good suggestions and good, plans for lifting the quality and lifting the performance of aged care, including by improving the access to home care, trying to improve the number and skill of the workforce, and including the governance of providers. That is the ability by which organisations can organise themselves to deliver good care. The challenge now is that we need to implement those changes. And obviously through the budget, there has been some strategies and initiatives that has resulted in implementation of changes and improvements. But at the end of the day, the immediate answers will have to come from providers and organisations providing aged care to look at what can we do differently, what can we do better, and how can we talk to our consumers, how can we talk to older people, how can we talk to our community members, how can we talk to their family members and their loved ones and their carers, and ask what is it that you want from aged care and how can we deliver it?
Yeah, you kind of already headed into like my next question already, which is fantastic. But I just wanted to know whether in regard to the Royal Commission, so all the recommendations that you've already outlined in regards to aged care providers, whether you could already see those changes being made to providers. So you've kind of answered that a little bit, but maybe could you go a little bit more in depth for us?
So I think one of the biggest motivators for action right now is the fact that the Aged Care Quality and Safety Commission, which is the regulator of aged care, is receiving increased funding to monitor the performance, monitor the delivery of care. And that basically involves going out, visiting providers and doing an assessment to understand how well the care and services that that provider is delivering are meeting the aged care quality standards. Now, this is a big driver of action for providers to prepare so that they are not trying to so they're well prepared, they understand what care they should be delivering in accordance with the aged care quality standards, where the gaps are, and what they're going to do to address those gaps. So the immediate action that I can see most of the sector taking is to better understand and implement care in accordance with the aged care quality standards in order to be ready for a visit by the regulator, the Aged Care Quality and Safety Commission, and avoid any notices of non-performance or non-compliance against those standards, which will then be published to the public. So there's kind of, I guess, a bit more of a stick approach right now rather than a carrot, and that is that providers are motivated to look at improving care and services to avoid the regulator telling them that they're not doing that and the repercussions that come from them.
Yeah, that's fantastic that there are already changes being made. Maybe not incredibly massive changes right now, but it's really great that aged care providers are trying to make those changes already. In regard to the federal budget, which I know you answered previously a little bit as well, do you think that the federal budget has given a substantial amount of funds in order for aged care providers to sort of make these changes that you've already sort of mentioned that they're trying to make?
Yeah, so certainly there was record investment in aged care as a result of the Royal Commission and the challenges we've seen in relation to COVID-19 over the previous 12 to 18 months, particularly in aged care facilities. So a huge amount of money has been allocated, and we've got some key pillars by which that money is going to be spent. Regardless of the sheer volume of funds, media and general commentary has been that that's still not enough. That, the amount of GDP we spend on aged care is still quite low, less than what other countries around the world spend, and that we have to find new ways to raise greater revenue to be able to afford quality care for our older people. The other challenge is throwing money at a solution doesn't necessarily result in the outcome that you need. Throwing money at a problem doesn't necessarily result in the solution or the outcome that you need. And so the question is, how is that money actually spent in a way that can translate into real improvements in quality and safety of care? And what that requires is quite specific guidance and direction from the Commission, from the government, or from providers themselves about what is going to make a real difference to lift the standard of care across all providers and for all consumers that are receiving that care. Whether that's increased training of the workforce, or better governance, or something else. The question is, how do we spend that record allocation of money in a way that's going to sustainably improve care, not just for now, not just in the short term, but for the longer term, and for the growing numbers of people that are going to need care, and for the growing complexity of older people?
Yeah, definitely. And I think, like you said, the budget has allocated an incredible amount of money towards the aged care sector, and like you said, needs to sort of go into more specifics in how they can handle this amount of money that the aged care sector has already been delegated. So I think one thing that the Treasurer has outlined is an extra 80,000 home care packages, one of the options that you mentioned for the aged care sector, an extra 80,000 home care packages to be used to clear the current backlog. Well, it would be enough, that's what the Treasurer said, to clear the current backlog of applicants already. Do you think that this is the only thing that can be done, or that needs to be done to clear the backlog, or does more need to be done?
I think certainly there is the desire for people to stay living in their own homes for as long as possible is not going anywhere. And supporting people in their own homes is good for the person, and it's also good for the government, because it is cheaper overall to deliver care in people's homes rather than in an aged care facility or an aged care home. Certainly maintaining quality and safety of care in people's homes is not simple. It is complex to work out how do we make sure consumers receive a good service and staff are safe, and that the environment is safe, and that we constantly monitor and are able to respond to changes and deterioration in the person's condition. Those issues are not as straightforward when you're providing care in someone's home as they may be when you're providing care in a aged care facility. We have a huge number of new packages announced to clear the backlog, but that doesn't account for the growing people that are going to want and need an aged care package. So we might be able to patch up the backlog in the short term, but the question is, in the long term, are we actually building capability of the workforce and maybe building capability of providers to adapt their care model into a model that is suitable to be delivered in people's homes for much longer with people of greater complexity, in order to avoid the need for admission into residential aged care facilities. So certainly, while we should definitely focus on home care and increased investment in home care and supporting people to live well in their own homes, we can't expect that just offering additional packages is going to guarantee safety and quality of care, and is going to guarantee that we will be able to support more people for longer. There needs to be greater, I guess, understanding of the complexities of delivering care in people's homes and understanding how that care is coordinated and integrated with other healthcare, including how the provider works with the general practitioner, how the hospitals communicate with an aged care provider, and how families and other supports, carer supports, are engaged and involved in supporting the provider and supporting the person to live the best life that they can.
Yeah, exactly. So essentially what you're saying is that the 80,000 new home care packages, it's a good start. However, there needs to be better integration with the other sectors within not just aged care, but healthcare in general, in order to provide those who are in need of aged care facilities a better life for them, essentially.
I think a big challenge is when you say people require safe and quality care. The question is, what does that actually look like in practice? How do we know if care is quality or not? We know that when care is not quality, we know when care is not safe, we know when people are feeling abused and neglected and that their health outcomes are declining. But what is good care? You may know a little bit about what good care is in a residential aged care home, but what is good care and what are good outcomes for consumers living at home is probably still a little less clear, at least it is to me. So I think actually being better at understanding what makes a good quality home care service is going to be really important to make sure that those increased number of packages actually are leading to better experiences and outcomes for people receiving care, but also those people that are delivering care.
Great. Yeah. So I guess sort of wrapping up our conversation here, what are your thoughts on the future of aged care in Australia based on the recommendations of the Royal Commission as well as your own knowledge and opinions of the aged care sector?
The future of aged care is not one size fits all. So we can't invest and put all of our eggs in one basket. We have to understand that there is diversity, that people have individual needs, goals and preferences, that people have different healthcare needs, different family supports, that people have different income and capacities to pay. So we cannot just expect that there's going to be one aged care model. We need to have multiple aged care models and be able to enable people to choose what is the model or what is the care that they best need, and understand that even if that's the model or care that they need right now, that may change over time. So we need to be able to be constantly reviewing and monitoring and tailoring our approaches in accordance with the changed needs, goals and preferences of the person. For me personally, I know that when I get to older age, the idea of living by myself in a house that I'm unable to maintain without much community nearby would be a very lonely experience. And I also know that the idea of living in a big, huge residential aged care facility with many, many other people who I don't necessarily know, particularly if I've got cognitive or functional decline, doesn't sound great to me either. What I quite like is the idea of my current circumstance where I'm living in a small apartment block in an area where I've got access to shops and cafes, and where the apartment block community are quite close, quite integrated, quite supportive of each other. Therefore, it reduces the loneliness, and it also removes the sort of impersonal nature of a large facility. So I think innovative models that are more embedded in community life is going to be really important, as well as options to understand that what I need is not the same as what someone else is going to need.
Thanks so much for your thoughts and comments, Sarah. They've been really insightful into what supports people in the aged care sector can look forward to, as well as the future that Australia has for it. Looking forward to chatting more in the near future once we start to see these policies implemented. Thanks everyone for tuning in today, and be sure to check out the My Care channel for other content for your healthcare needs.